doing today? This is Dr. 𝙬𝙤𝙩𝙝, Performance Plus Physical Therapy. Hey Joanne, how are you? This is Q&A with Dr. D. Today is May 18th. It is Monday. How is everyone doing today? I'm gonna wait for a couple of people to come in while I get set up on IG. Joanne, how are you? We need to catch up. How have you been? I hope all is well. I feel like we need to catch up at some point. How is everyone out on Facebook? I hope everyone is doing well. Joanne says yes, please. Yes, let's catch up. All right, just waiting for a couple of people to come in here. Guys, today, this week, we are talking about the elbow. Elbow is a pretty interesting joint. One of my favorite joints, actually, ironically. I don't see it often, but when I do, it's a great puzzle. The elbow is a very interesting joint, so we'll get started. Today's topic that we're talking about is common causes of elbow pain. The elbow doesn't hurt often, but when it does, it hurts a lot. So we'll dive into that. Joanne, how was the weekend? What did you do? What you've been working on these days? I feel like you're working on something. Something's going on. Tell me about it. You said all is well and yes, catch up soon. Okay, yes. Please, let's catch up soon. Miss Dibs, how are you? Thank you for joining. All right, guys. So let's Joanne says lots of workshops. Ooh, we gotta talk. That's pretty exciting. Okay, guys. So we're gonna get started. So Dr. 𝙬𝙤𝙩𝙝, Performance Plus Physical Therapy, Q&A with Dr. D. Today and this week I'm going over all things concerning the elbow. And today's topic is common causes of elbow pain. So guys, the elbow is a pretty interesting joint. It's a joint that is not frequently injured, and you usually have to do something pretty interesting to damage, specifically traumatically, the elbow joint. And but again, it's a pretty interesting joint in terms of the things that are going on that can happen with it. So what I'm going to go over, guys, is a little bit of anatomy, so you guys can understand, like what exactly makes the elbow special. And I'm going to go over a couple of common causes of elbow pain. And then later on this week, as we go along, we're going to dive a little bit more into some of those specific diagnoses that you may have commonly heard or may have experienced yourself. Okay. Joanne says, come to Healing the Healers, you love it. I will. Send me the info. I'm happy to support you if I can. All right, guys. So talking about the elbow, and I have my little model here to show you guys. You guys know I love models. Okay. So here, guys, we have a picture of the elbow, and the elbow. The things that we see in terms of our anatomy is we just see this little kind of a weird joint, this thing that sticks out, and we think of this part of just being your elbow, but the elbow is an actually pretty complicated joint. Okay, it is a hinge joint, and I'm going to turn this around so you can see it from the back. The back part of it, you can see, is actually a hinge joint. Okay, and if you guys know what a hinge is, think of like the hinge of a door. In terms of the mechanics of how that works, that's exactly how the elbow works. Okay, it's a hinge joint, but also what's unique about the elbow is that it has an articulation. I'm going to enlarge in this here, where it's not really a hinge. So the hinge happens with this bone and with this bone. For those guys on IG, I just described the green one highlighted and that bone, those two ones. But then there's also another joint that happens here because there are two bones in your forearm. Okay, so the hinge joint is really the ulnar-humeral joint. That's a hinge joint. It's a very stable joint. You got to do something really exciting to make sure that you injure that joint, meaning you've had to have fallen your body weight traumatically on that elbow. So when you start thinking about elbow fractures, that's where that sort of injury is going to happen. You have to do something really strong to really damage that joint. Okay, and then when we talk about the other part of the elbow, which is really the radial-ulnar joint, which is those two forearm bones, and also the radiohumeral joint, there's a spin that happens, a spin and a glide that happens at this radial head that you can see outlined right here that happens when you move your forearm. So when we think about it, guys, when we think about the elbow, there are actually two things or two sort of mechanics that are happening. You have bending, or what we call flexion, extension, or what we call extending, and then we have, as we talked about, that spin and glide at that radiohumeral joint that happens. So anytime that you are in a position where you're flipping your forearms down and back up, if you can rotate your palms up to the ceiling and then rotate your palms down to the floor, you're going to realize that there's a rotation component that's happening at your forearm. That's what's happening at the radial ulnar joint, and also to an extent at the humeral ulnar joint. Okay, guys? So that's some of the interesting mechanics, and that's some of the things that kind of makes the elbow very special. And you will realize once you start going through a lot of the injuries and looking at the injuries that happens at the elbow, it really sorts of outlines the type of injuries that can happen at the elbow. Common things that can pop up with the elbow is a lot of tendonitis. So you would hear about tennis elbow that happens on the outside of the elbow. You would hear about golfer's elbow, which happens on the inside of the elbow. You can get triceps tendonitis. The triceps inserts right at the end of the elbow into the forearm, at the base of the forearm. You can have bicipital tendonitis that usually happens higher up, but it can happen lower down also. And you can get lots of fun strains that happen through the forearm that's also connected to the wrist, okay? A lot of people usually think that once you have an issue with a joint, that usually the joint is the issue, but in terms of the musculoskeletal world, you would really notice that a lot of the problems that actually happen to the muscles, and the end of the muscles is where the issues start happening. Hi, Isha, how are you? Right? So guys, so even though we are thinking of the elbow as the issue, a lot of times that problem is either starting from higher up, coming from the shoulder down, or from the forearm going down into the hand, okay? So common things that you will see with the elbow, you can get neural compressions or neuropathies that are happening. That usually starts higher up in the shoulder, and also in the thoracic outlet area, and comes down into the elbow. But it is common to start getting some compressions of nerves that happens right here, specifically with the ulnar nerve. But again, the most common things that's going to happen with the elbow are the tendonitis. So tendonitis of the extensors of the wrist that sits right on the outside part of the elbow, or problems with the flexors of the wrist that starts on the inside of the elbow. And again, you can start getting biceps issues, or you can start getting triceps issues. There's also all sorts of other things that can happen. You can have bursitis. You can have lesions within the bones in terms of arthritis issues and stuff like that. There's a lot of fun stuff going on. Tatiana, hi Tatiana, how are you? It has been a while. Thank you for joining. So there's a lot of interesting things that can happen with the elbow. So one thing that I want to go over in terms of the mechanics of the elbow, guys, that I think is really important to understand, that's going to pop up a little bit more as we talk about this during the week, is understanding that the elbow, the things that really affects the elbow really reflects what's happening either below, which is the wrist, or what's happening above, which is the shoulder. Think of the elbow as an extension of what happens with the knees, and we talked about the knees quite a while ago. Okay, there are a lot of mechanics of knee problems that actually originate as foot issues or originate as hip issues. The elbow is actually not quite different. Okay, a lot of the stability that needs to happen at the upper extremity should actually come from the shoulder. So you will find that depending on your sports or the type of injury that you have, that if your shoulder is not stable, it's going to start manifesting itself as elbow pain and even as wrist pain. Okay, so as we go through again this week, you'll see that we'll talk about quite a few injuries and how we treat it, that we actually do address the issues that are happening at the elbow, but we do want to go proximally or closer to the body, as we call it, in the medical world, to address any sort of instability issues higher up that's going to manifest itself as elbow pain or lower down as wrist pain, depending on the injury. All right, so I hope you guys have a little bit of a clear understanding of what the elbow looks like, some of the issues that can happen with the elbow, and we will dive a little bit more into those details as the week goes on. Okay, I'm gonna check to see if you have any questions. Ms. Tatiani, we need to catch up because feel like you have a lot going on. Please, let's catch up. Okay, I'm gonna check to see if we have any questions on IG. Anything that for me, guys, that you can put into the comments. If this was helpful, give me some hearts. If you want to have a specific question about the elbow, please drop it in. Tomorrow we're going to be talking probably about tennis elbow, which I think is going to be really interesting. Okay, and this is something that people get quite a bit, which is pain on the outside of the elbow. Okay, so Joanne says talk soon. Thank you. You're welcome. All right, so that's it for today, guys. Short one for today. The elbow, again, you got to do something really exciting to start having consistent elbow pain. It is not a common diagnosis. It is not a common area of the body that frequently gets injured. There are lots of exciting traumatic things that can happen. I'm going to focus more of my talks on the things that are really overuse repetitive injuries, such as tendonitis and bursitis, that sort of stuff that you can easily fix on your own. We won't dive too much into the traumatic stuff in terms of fractures. So tune in tomorrow, guys. We'll talk more about the elbow and all of the fun things that can happen with it. And at the end of the week, of course, I'll go over things that you can do to help with your elbow pain. All right, so have a wonderful Monday, and I will talk to you guys soon. Bye.